Hi,
Hi,
how are you?
I'm hanging in there. How are you?
Tired.
Hey, I understand that kind of thing, actually.
I've been working since 5 a.m. so I'm
Okay, I
exhausted.
can't say that. I can't.
How's your spring break?
It was busy. Because I teach at 3 schools and they have different scheduling of spring breaks. I kind of had one, but I didn't have one at the same time. But it's all right.
I didn't have one either.
How you didn't? Did you not do anything fun?
I just worked. I also started my second half semester course here, so I was like working on that classwork to get ahead.
Okay, I can understand that.
So how does that work? Like, since you do multiple colleges, like, do you just go to like each campus? Like, do you just be each campus once a day, or like how does that work?
So on Monday and Wednesday mornings, I go to Carroll Community College and I teach face-to-face there. And on Tuesdays and Thursdays, I teach at Stevenson face-to-face. And then on Mondays and Wednesday nights and Fridays, I teach online for Hack.
Is it worth it?
Is it worth it?
Yeah.
It is.
That's a lot.
It feels like a lot, and I feel like I'm kind of drowning half of the time. But at the same time, I wanted the experience. I'm getting a lot of experience, and so I'm getting what I asked for. This is what I wanted. This is what I'm getting. Does that make sense?
Yeah, that does make sense.
And I've had jobs. The one thing that I don't do, that I've had lots of other jobs.
What are you doing?
I've had lots of other jobs that I did not enjoy very much. And I'm amazed, how little I complain, over the last year of, working like mad sometimes and feeling tired and feeling stressed, but I don't complain. And that says a lot about how I feel about it. Does that make sense?
Yeah, that does. Do they just kind of like? I was just kind of curious to say like what it's like on the opposite side, because you don't really get that perspective, as a student.
Right. I enjoy it. I like hopefully helping some of my students avoid some of the pitfalls that I fell into. And I like that. I feel like hopefully I'm making a difference for some students. Does that make sense?
Yeah, that definitely makes sense.
Are there any questions, concerns?
Not really. I mean, I was just surprised when I was doing the Wiley labs yesterday. When I was, because like I'm used to having the unlimited attempts for the questions.
You know what? I reset that, Lauren.
Okay.
I think it may have been you who actually said something to me. Someone said something to me, and I changed.
Yeah, I said it.
Okay.
Me also. I texted you.
Yeah, there's a setting that I didn't hit, and I needed to select it.
And I was checking the smart book. Oh, I think it's chapter 12.
Okay,
There, let me see. Yeah, he given us 1 hour and 32 minutes. I don't know,
all
something
right.
like that.
So Kisbel, you've got to start again. So you were checking it, or it only allowed you to go for 1 hour, or what?
And like 32 minutes, I think.
And what happened?
No, I didn't do it. I just wanna, ask you first because it didn't like have time. The smart book.
It didn't give you time to do it, or
Not well before. It
uh-huh.
didn't used to have like time. We also, for example, me, I can do 5 questions today or 5 tomorrow, but now it's giving me 1 hour and 35 minutes to do it.
It shouldn't. It shouldn't. They're not timed.
It's so
Unless
weird.
it's a quiz, then they're timed.
No, no, it's not a quiz. It's the smart book.
Well, is anyone else ran into that?
I have it, but I do see the timed part on there. This is Christina,
Yeah.
but it should still really let you finish it, or it will test you through those reading questions until you get all the concepts. So
Right.
I wouldn't worry so much about the time because I went back and forth. It took me like 3 different attempts to do all of it, and it was fine.
It will probably, it's what it's doing, it's collecting a lot of stats when you do that. Because if I want to go in and look at how the students are doing overall in a class, I can go in there and click on the exercise, see how long it took, what concepts were harder than others. So it may be timing you whether you realize it or not, but it doesn't affect your grade. Does that make sense? Tisbel?
Yeah.
I have a question real quick too. I was having a problem with, I don't know if anybody else did, but I was having a problem with the case study. No, not case study, the extra points. I was
Okay.
trying to do them over, the break time. And for whatever reason, after I do the first question, it won't let me go to the next one. Like I couldn't see any other questions other than the first one. So I tried all, the different extra credit questions that you had listed, and the 3 of them just disappear after doing like one
Have
question
you tried
on
calling
each.
McGraw-Hill? Did you try calling McGraw-Hill?
No, I did not. Should I go
I
through
would try
that?
to call them because it sounds like it's not loading.
Okay. Yeah, it was getting stuck on the first question, and then I couldn't do the rest of them because it was just grading me off of like one question that it was
Yeah.
giving me.
It sounds like it's not loading.
Okay. Okay. I'll try it that way, and then I can email you to let you know then.
Okay,
Okay. Thank you.
you're welcome. We are falling behind, and I'm not really concerned. I'm kind of concerned. I'm not really concerned. Somewhere in the middle. But if you want to ask me something that you know is probably not related to what we're talking about in class, let me know afterwards. Let me know after class. I'm more than willing to stay around and talk to you after class. But if you don't think it's related to the subject that we're talking about, wait until after class to ask me about it. Because I'm willing to, explain things. I'm willing to discuss things, but I do have to get through a certain amount of material before the semester is over. And so my goal tonight is to finish the majority of chapter 12. And a part of the reason I'm also a little concerned is because we're staying on top in lecture, but we're getting behind in, excuse me, we're ahead, we're getting behind in lecture, but we're staying where we should in lab, which means that we're constantly going over things in lab that we've never seen in lecture. And it's not always a bad thing, except when it's been 2 weeks, like spring break. So let's just go forward. But if you know that you want to ask me something that may or may not be related to what we're talking about, do me a favor and wait until the end of class. Oh, someone else asked me about where to submit your case studies. If you look right here under Dropbox, this is where you submit them. Okay.
I have a question regarding the case study.
Okay.
So you said it was earlier in the week. Did you say it was okay to like copy and like paste and then answer the question?
Yes, that's fine.
Okay, even if we didn't, even if I just like created a separate, you know, where you have to create like the graph for it was like the first question. Now, how do you want that though? Like, do you want us? How should we go about that? Like, should we make a Word document specifically centered on that, and then, or should we add it to
submit
the
it as 2 separate documents.
Okay, I was just
It doesn't really matter to me, as long as it's
Okay.
all there.
Perfect, thank you.
The folder allows you to make multiple submissions.
Right,
And
I just didn't know if that would be acceptable.
Yeah, that's fine. That is fine.
Thank you so much.
You're welcome. Okay, so some of this may be a review of lab the other night. Some of it is going to be new. So nervous tissue, chapter 12. And you guys, just so I don't feel like I'm talking to myself, if you'd be willing to turn on your cameras, I'd really appreciate it. I like it because then I can kind of look at how you're doing and what your facial expressions are. And if you look confused, I know that something isn't clicking. So 2 organ systems that are dedicated to maintaining internal coordination are the endocrine system and the nervous system. The endocrine system is going to communicate via hormones secreted in the blood. In contrast, the nervous system is going to employ electrical and chemical means to send messages, such using neurotransmitters quickly from cell to cell. Both of these systems work to maintain homeostasis. Remember what that means, to keep things within a narrow boundaries. So both of them work. One of them is working by electrical and chemical signals. One of them is working by chemical signals. We'll talk about the fact that when we're referring to the endocrine system, it secretes a chemical signal, a hormone into the blood that floats around in the blood for who knows how long. And when it reaches a receptor on a cell that it can bind to, it binds to that receptor and signals a reaction. In contrast, when we're looking at the nervous system, it's going to use electrical impulses that are initiated via chemical means, or they're initiated or they're blocked by chemical means, where the neurotransmitters, which are similar to hormones and sometimes can be hormones, are moving across a very small cleft versus they're not secreted in the blood, they're just moving across a few micrometer width cleft. So neurology is the branch of medical science that deals with the normal functioning of the nervous system. The neurons are the nerve cells. The neuroglia are the cells that support the neurons. We talk more about the neurons than we do the neuroglia, partly because we know more about the neurons than we do the neuroglia. And they tend to be the ones that we see their actions most frequently. However, the neuroglia we have to be careful that we don't overlook them, because we're realizing that they play a lot more parts in the function of the neurons than we previously thought. And that they're involved in regulating the actions of neurons. The neurons are essentially the electrical wires, but the neuroglia are going to be the insulation around the wires. They're going to be whether that neuron survives or fails. So the nervous system carries out its task in 3 basic steps. Sense organs receive information about changes in the body and the external environment and transmit coded messages to the brain and the spinal cord. The central nervous system then processes that information and relates it to past experiences and determines how to respond, or if we're going to respond at all. The central nervous system then issues a command to muscle and gland cells to carry out those responses. So when we're thinking about this from here on out, afferent neurons are incoming sensory neurons, bringing information in. Incoming sensory neurons. Efferent neurons are outgoing or exiting the central nervous system, outgoing. I'm going to add some words in here. Incoming or approaching. Actually, let me say it this one. Incoming, approaching, or entering sensory neurons. efferent neurons are exiting or leaving neurons. When we say they're entering, we're saying they're entering the central nervous system. When we say they're leaving efferent neurons, they're leaving the central nervous system. Afferent neurons are always sensory neurons. Efferent neurons are always motor neurons. Interneurons are only found in the central nervous system. And are connect or interrelate, serve to connect or interrelate there's two R's. Interrelate sensory and motor neurons. Keep that in mind. So sensory neurons or afferent neurons are bringing messages in to the central nervous system. They synapse with an interneuron. The interneuron synapses with a motor neuron, an efferent neuron, which goes out to muscles or gland cells to carry out whatever responses have been deemed appropriate. Afferent neurons are in the peripheral nervous system. Efferent neurons are in the peripheral nervous system. Interneurons are only found in the central nervous system. So the central nervous system consists of two main structures, the brain and the spinal cord. The peripheral nervous system contains all 31 pairs of spinal nerves and all the pairs of the cranial nerves, which includes 12 or 11 and a half pairs. And we'll talk about why I'm saying that. If you look in your book, it probably says 12 pairs. However, most recent information out there about cranial nerves says that spinal accessory nerve, the very bottom here, is actually, part of it is not a cranial nerve, part of it is a spinal nerve. And we'll get to that when we talk about the brain in the next chapter, or the next chapter after that. I can't remember. So the central nervous system includes the brain and the spinal cord that are enclosed and protected by the meninges, the cranium and the vertebral column. The peripheral nervous system is all the rest, that's composed of nerves, which are bundles of nerve fibers or axons, wrapped in fibrous connective tissue that emerge from the central nervous system through foramina of the skull or the vertebral column and carry signals to and from other organs of the body. The ganglia are not like swellings in a nerve where cell bodies of peripheral neurons are located. So in the peripheral nervous system, we see nerves and ganglia. Nerves are axons, bundles of axons. Ganglia are bundles or collections of cell bodies. Peripheral nervous system can be divided into different branches. We have the sensory division. Remember, that's your afferent neurons. Your motor division, which is your efferent neurons. Your sensory division can be divided into two other divisions, the visceral sensory division and your somatic sensory division. Somatic means, bear with me here, I have to remember, skin, muscles, tendons, bones. Visceral is specifically organs, internal organs that aren't included in that first category. Your motor division is has your somatic motor division, which is your muscles, skin, and bones, and your visceral motor division, which is also called your autonomic nervous system. So another name for the visceral motor division is the autonomic nervous system. Autonomic meaning that it's involuntary actions. It's automatic. And it includes the sympathetic and the parasympathetic division. Any questions so far? So the sensory or afferent division carries signals from different receptors, sense organs, and simple sensory nerve endings to the central nervous system, informing the central nervous system of any changes within or around the body. The two divisions are the somatic sensory division, which, remember, that includes the skin, muscles, bones, and joints. And the visceral sensory division, which includes the signals from the viscera, meaning your internal organs such as your heart, lungs, stomach, urinary bladder, and so forth. So both are going to you're going to receive signals from your skin and your muscles and your bones, and simultaneously your central nervous system is receiving sensory information about what's occurring within your internal organs. The motor efferent division carries signals from the central nervous system out to the glands and muscle cells that carry out the responses. The effectors, another term, effectors are the organs and cells that respond to these signals. So there's two divisions of the motor efferent division. The somatic motor division carries signals to skeletal muscles, is going to produce voluntary muscle contractions as well as autonomic reflexes. Remember, when we think of autonomic, we're talking about involuntary. So somatic motor division is going to carry out voluntary muscle contractions and also involuntary muscle reflexes. The visceral motor division or autonomic nervous system is going to carry out signals to glands, cardiac muscle, and smooth muscle. These are usually involuntary. There are some things about the autonomic nervous system, even though we know that it's typically involuntary, there are certain things about it that do make it very voluntary. But it tends to operate on an unconscious level. And the responses of the autonomic nervous system are called visceral reflexes.
Would that be part of like the heartbeat?
It would be the heartbeat. If you've ever, let me give you an example. Two major examples. So my mother's in her room. She's locked up in her room right now. But she will tell you that I'm renowned in my family for my ability to faint and pass out. And I worked for the NIH for 3 years. And when I was working for the NIH, I passed out my second day on the job. Ended up getting, I was working with muscle biopsies, and I have never really been really great with blood. I really don't like blood. And we were doing skeletal muscle biopsies, and I got sick watching a biopsy. And I knew myself well enough to recognize what was happening. So I didn't like pass out on the floor there. But I kind of felt the wall and got out of the room and walked out into the hallway. But then 3 years later, because I learned how to deal with it, 3 years later, when I got splattered with blood from a similar biopsy, I got splattered with blood. It was all over my lab jacket. It was on my face. And the PA that I was working with was like, "Are you all right?" And I'm like, "Oh, I'm fine. No worries." And that's, your ability to faint is involuntary, but can you control it on a certain level if you work at it? Say with the heart rate, it's the same thing. Is there a way for you, if you know people who deal with panic attacks, is there a way to consciously bring your heart rate down? What would you say, Lauren?
So when it comes to my clinic, like we deal with, dialysis, so we deal with heart rates and everything. If we notice our patients' heart rates are like elevated, we kind of ask them what's going on and, try to calm them down a little bit, because sometimes, if they're watching, a lot of them are older grandfathers, grandparents, so they like to watch the news on their little TV screens. So we're like, "What are you doing? Like, what are you watching?"
Yeah.
And like, "Oh, watching the news." And we usually ask them to change, and then the heart rate goes back to normal.
Well, and you can, if you know somebody who deals with panic attacks, a counselor will work to try to teach them how to control it. And what you're doing is you're actually controlling your autonomic nervous system. Because if you've ever dealt with a panic attack, it feels like you're having a heart attack. And what's occurring is that your heart rate is becoming really, really high. So are there ways for you to physically bring yourself back down? And there are, but it requires training. So two major divisions of the autonomic or the visceral motor division. The sympathetic division arouses the body for action, accelerates the heartbeat, increases respiratory airflow, and inhibits digestion. The parasympathetic division has a calming effect on the body. It slows the heartbeat, but stimulates digestion. Major fundamental or properties of neurons: excitability. Your neurons will respond to environmental stimuli. They respond to the stimuli by conducting electrical signals that are quickly moved from cell to cell. Secretion: when the signal reaches the end of the nerve fiber, the neuron secretes a neurotransmitter that stimulates the next cell. So excitability, being able to respond quickly. Conductivity, being able to carry an electrical signal. And secretion, being able to secrete a neurotransmitter that will affect the next cell. Two major types of nerve cells: the neurons. There's about 1 trillion neurons in the nervous system. So about 10 times more neurons in the nervous system than there are stars in our galaxy. And if you think that's a lot within one person, look down at the neuroglia. But neurons branch so extensively that they make up for about 50% of the volume of the nervous system. These neurons are going to transmit signals throughout the body. So there are about 1 trillion neurons. Neuroglia, in the neuroglia within your body, there's about 10 to 50 times more neuroglial cells than there are neurons in your nervous system. They play a major role in supporting and nurturing the brain, but they do not manipulate the information. They maintain the internal environment so that neurons can do their jobs. So here's your neuron, and all the little dots are neuroglia. So afferent neurons specialized to detect stimuli such as heat, light, pressure, chemicals, and transmit that information about them to the central nervous system. They reside in the peripheral nervous system. They begin in almost every organ and end at the central nervous system. Some of the receptors are sensory neurons themselves. Others are separate cells that communicate directly to the sensory neuron. Interneurons make up about 90% of the neurons. They lie entirely in the central nervous system, and they receive signals from many other neurons and carry out the integrated functions of the nervous system. So they process, store, and retrieve information and make decisions about how the body is going to respond to stimuli. The motor efferent neurons are going to send signals to effectors, the muscle and gland cells. Do you see the different parts of a feedback loop here? Remember what feedback loops are. Do you see, since I can't see any faces at this moment, do you see them?
Yes.
Okay,
Yep.
where is, what are they? What are the different parts?
Sensory to interneurons, then to motor or efferent neurons.
So let me give you, I'm going to skip just for a second. And we'll see this again later. But so there are 5 parts. You have the receptor, which is going to receive the stimuli, senses the stimuli. Senses stimuli. The afferent or sensory neuron neuron which sends sensory information to the central nervous system. Interneuron, which is the integrating center. Integrating, we can call it integrating neuron. That is in the central nervous system. AKA integrating center. Efferent efferent motor neuron. Which relays sense motor information out to the effectors. And the peripheral nervous system. And the last part is the effectors which carry out the response. So this lies in the peripheral nervous system. This is in the peripheral nervous system. This is in the interneurons in the central nervous system. This is in the peripheral nervous system. And this is in the peripheral nervous system. And rather than saying sense motor information, I'm going to say sense information about out to the effectors in the peripheral nervous system about what response the effectors should carry out. Carry out. Guys, remember this. Write those down because we're going to see it over and over again for the rest of the semester. So while studying for an exam, you reach for a beverage, and to extend your arm, your what nervous system is activated?
Somatic, D.
It's somatic, that's right. Good job, Justin. Another example of a neural feedback loop. Sensory function, you smell coffee that stimulates the sensory receptors in the nose. Integrative function, that olfactory information is relayed into the brain where it's processed and the decision to drink the coffee is made. The brain stimulates the contraction or initiates the contraction of specific muscles that allow you to grab the cup and drink it. Any questions? The motor neuron, so the general structure of a neuron. So you have the soma or the cell body, which is the control center of the cell. It contains a nucleolus, which remember that's where we make things like ribosome subunits, and other organelles, including the rough ER that contains chromatophilic substances or Nisi bodies, and a cytoskeleton, which includes neurofilaments. There are no centrioles found in neurons. What were centrioles important for?
Cell division.
Cell division. I was like, I'm gonna slide down my screen. What did they do in cell division? Do you remember?
They like align the chromatids so that the cell can have, you know, an equal amount of genetic material
Right.
in each new cell.
Right. So they align the chromosomes they put out the microtubules, which are going to align the chromosomes at the center of the cell. If neurons do not contain centrioles, what that means is that they do not undergo mitosis. This is what's so devastating about neural injuries, is that especially in the central nervous system, there's no way to replace those neurons when they get lost. Dendrites branch off from the soma. These are primary sites for receiving signals from other neurons. The more dendrites a neuron has, the more abilities it has to receive and incorporate information and make decisions about what it's going to do. We have neurons that have lots of dendrites. We have some neurons that have very little dendrites. The more dendrites a neuron has, the more sensitive it is, and the more ability it has to integrate lots and lots of information. From the axon hillock, the axon is going to originate. The axons are relatively unbranched, but it may have axon collaterals that originate near the soma. The axons are specialized for rapid conduction of nerve signals. The cytoplasm is called axoplasm. So if you remember plasm always means cytoplasm. I think we've talked about this maybe before. Neuroplasm, I don't know if we have, but axoplasm means the cytoplasm within the axon. Lemma always means the plasma membrane. Axons may be myelinated. I know that I've mentioned these words before, but I'm going to write them down again. Just when I write things down, when I make the time, when we stop and I type things out for you, do me a favor, make a special note of those things. Because what I'm trying to do is tell you, yes, the PowerPoint, there's a lot of information there, but what's most important sometimes are the things that I'm specifically taking the time to type out, because if you haven't noticed, I'm not a very fast typist. So neural lemma. Remember neural lemma from last 2 weeks ago is the outer plasma membrane of the myelin. Myelin outer plasma membrane, outer membrane. Outer membrane, let me put it differently. Outer membrane of the myelin. The axolemma is the plasma membrane around the axon. At the distal end of the axon, there's usually a terminal arborization. What does arbor mean? You
Would
ever
that be
heard the
branching like a tree?
branching like a tree? You've heard of like the Arbor Society? It's like a national society. That's where this name is coming from. So it's like a branching out of a tree, like Justin said. Each branch ends in an axon terminal that forms a synapse with the next cell. Each axon terminal contains synaptic vesicles that contain neurotransmitter. The terminal end of the axon is this complex of fine branches, and at the tip of each branch, there's a synaptic knob or terminal bouton that is going to form a junction, a synapse, with the next cell. Neurotransmitters are signaling molecules that are used in synapses that can pass either excitatory or inhibitory signals from one neuron to the next target cell. Any questions?
I do.
Oh.
So I remember earlier you said that, damage to the neurons is irreversible. Could that have like long lasting consequences like to mental health disorders as well?
Usually a lot of the mental health disorders are, it can, but a lot of it is synapses and neurotransmitters. Long term, could it affect the neuronal structure? Yes. But a lot of it has to do with neurotransmitters. One thing that a lot of your drugs that we use for treating mental illnesses are being directed at neurotransmitters. So a lot of it is what's going on right here. And we'll talk about that later. That's something I know we're going to talk about later. Is because we'll talk about, I only know about some drugs. I know what Prozac does. I know what some other drugs do. I know why it's also why some things are as addictive as they are. Is because they're working on neurotransmitters. So different classes of neurons, multipolar neurons have one axon and multiple dendrites. These are the most common type and make up the majority of most of the neurons in the brain and spinal cord. Bineurons, or excuse me, bipolar neurons have one axon and one dendrite. These are specifically sensory. And all of them, as far as I know, are found in the special senses. For example, in the olfactory cells in the nose, your smelling neurons. Neurons in your retina involved in sight. Sensory neurons in the ears that are involved in balance and sound. I don't know of a bipolar neuron that's found outside of the special senses. And anoxinic, and I think your lab manual had another term for this. I can't remember what they called them, but it wasn't anoxic. These neurons have multiple, oh, you know what? Bear with me. I'm going to look it up. I'm sorry. Give me 1 second. I'm not going to tell you that I can't remember what it was. I'm going to look it up in the manual. They call them unipolar neurons. Unipolar, so axonic and unipolar are the same thing. So they have multiple dendrites and no axon. They communicate locally through their dendrites, but they produce no action potentials. They're specifically found in the brain, the adrenal medulla, and the retina. We'll talk about the fact that there's a specific substance found in the sympathetic nervous system that is in the adrenal medulla. And I'm guessing that's where these unipolar neurons are acting. So unipolar neurons, or axonic. Actually, are there 4 different classes? Why did we just think there were 3 different classes? You guys, I'm sorry, I'm getting myself confused. These are, I'm guessing, bear with me, I think these are what are going to be found in the sympathetic nervous system. Unipolar neurons have a single process leading from a cell body. They carry signals to the spinal cords for senses such as touch and pain. So these are, you're specifically looking at afferent neurons, carrying signals to the spinal cord, meaning they have to be afferent neurons. The single process stems off into a peripheral fiber and a central fiber. A peripheral fiber has a sensory ending far from the soma. A signal travels from the peripheral fiber to the central fiber and then to the spinal cord. And I'm going to do something really quick because I'm getting myself a little confused here. And I want to know what's the difference versus an axonic. I'm curious because if you look there, we didn't talk about this other day as being a functional structure class.
Can I offer an
Oh, please
observation?
go.
So the way that it's making sense for me to differentiate these two is that anaxonic, at least in that picture in the power slide,
Yeah.
it doesn't look like it has a clear axon. So being like not having an axon, anaxonic neurons are neurons that don't have a clear axon, but unipolar, it looks like there's one, long axon that is there. So I guess structurally, that's how I differentiate the two.
Okay. I'm going to go with what you say for right now, because I think you're right. And it may be that I'm tired tonight because it's not really clear for me. But what's the difference between a pseudo-unipolar and an anoxonic neuron? Yeah, I'm just not sure, but I'm going to go with what Max said. And I apologize. I don't know. I forgot that there were 4 classes here. I go through our PowerPoint really quickly right before class, and sometimes I don't read it as carefully as I should. But unipolar have a single process leading from the soma. They carry signals, so these are specifically afferent neurons. The single process is going to stem off into a peripheral fiber and a central fiber. The peripheral fiber has a sensory ending that's far from the soma. The signal travels from the peripheral fiber to the central fiber and then to the spinal cord. If you remember from lab, we talked about the dorsal root ganglion. You remember that from lab 2 weeks ago? This is the arm that's going into the spinal cord. There was that bulging, that dorsal root ganglion. Remember, that was cell bodies of a sensory neuron. This is the part that's going in and synapsing with the integrating neuron or the interneuron. This is the part that's out in the dorsal root ganglion. I'll bring this up again when we talk about the dorsal root ganglion again. but recognize that that's why these are specifically afferent neurons, sensory neurons. Axonal transporter, transporting the neurons. There's two-way passage of proteins, organelles, and other materials along the axons using microtubule monorails. Along these microtubule monorails, we have motor engines that can function depending on the transport of the directional transport and the speed. If components are moving from the soma to the axon terminal, it's anterior grade transport. And the motor engine is kinesin. Little kinesins carrying organelles along these monorails. If the substances are moving from the axon, from the axon terminal towards the soma, it's retrograde transport, and it's moving via dynein. Axonal transport occurs at a rate of about 200 to 400 millimeters a day, fast axonal transport. Fast anterior grade transport is going to move mitochondria, synaptic vesicles, and components of the axolemma, calcium, and enzymes such as acetylcholinesterase and other things from toward the distal end of towards the axon terminal. Fast retrograde, remember this is kinesin, this is dynein. Fast retrograde, which is carried out by the dynein, returns used synaptic vesicles and other materials back towards the soma and can inform the soma of conditions at the axon terminal. Pathogens such as tetanus, the tetanus toxin, rabies, and poloviruses take advantage of this fast retrograde transport to move a substance from a sensory receptor back to the central nervous system. You've probably heard that when tetanus is making a comeback because people don't want to vaccinate their kids. And it usually takes a few days for the symptoms to arise. Because the rate is only 200 to 400 millimeters a day, which means that you're moving 20 to 40 centimeters a day. And then it takes time for it to get up to where you're actually going to show symptoms. Slow axonal transport only occurs in an anterior grade process. So this is only going from the soma to the terminal. It goes just as fast axonal transport, but it makes frequent stops. So the speed is only 0.2 to 0.5 millimeters per day. It's going to move enzymes and cytoskeletons down the axon to renew worn out components and supply new axoplasm for developing and regenerating neurons. Any questions? Neuroglia are not electrically excitable. They serve to protect and support the neurons. Oligodendrocytes have a bulbous body and up to 15 different extensions or arms coming off that body. Each arm reaches out to a nerve axon and spirals around it. So each of these 15 extensions is going to go out to one segment of one axon. This wrapping is the myelin sheath that insulates the nerve axons and keeps up nerve conduction. Ependymal cells resemble cuboidal epithelium that lines the cavities of the brain and spinal cord, but there's no basement membrane. Remember how we saw that on all simple squamous, simple epithelial layers, a basement membrane? We don't see that here. They produce cerebrospinal fluid that's going to bathe the central nervous system and fill the cavities in the brain and the subarachnoid space. They have patches of cilia that help circulate cerebrospinal fluid. Microglia are little small macrophages. So phagocytosis, cells that eat things. Macrophages are big cells that eat things. They develop from monocytes, which are part of the immune system. They wander throughout the central nervous system, putting out finger-like extensions to look for cellular debris or other problems. They phagocytize dead tissue, microorganisms, and other foreign material. They concentrate in regions damaged by infection, trauma, or stroke, and aid in repair. For example, they can function in synaptic remodeling and changing connections between neurons. So, oligodendrocytes, ependymal cells, microglia, and astrocytes. Astrocytes have a many branch star-like shape. Astro meaning star-like in shape. They constitute about 90% of the cells in some areas of the brain, and they cover the entire surface of the brain and most non-synaptic regions in the gray matter. They have the most amount of functions of all the central nervous neuroglia. They provide a supportive framework for nervous tissue. They have perivascular feet, peri meaning to go around something, vascular meaning blood vessels. So they have perivascular feet, put out these little projections that contact blood capillaries and stimulate the formation of the blood-brain barrier. So they work in forming the blood-brain barrier. They monitor neuronal activity and stimulate dilation and constriction of blood vessels to regulate blood flow to meet changing demands. They also convert blood glucose to lactate because neurons can't directly absorb glucose. They also secrete nerve growth factors that regulate nerve development and promote synapse formation and fine-tune circuitry. So remember how I said at the beginning that, we like to say that neuroglia just support? Well, no, they're involved in regulating functions too, and regulating the connections and making those connections between neurons. They communicate electrically with neurons and influence synaptic signaling. They regulate the composition of tissue fluid, absorb released neurotransmitters, and potassium to prevent excessive levels of potassium being present. They also perform sclerosis or astrocytosis, meaning they fill the spaces formed that were formerly occupied with damaged neurons with hardened scar tissue. So you've heard of multiple sclerosis, scar tissue plaques. This is what's making those and what's performing that space filling and that formation of scar tissue. Now, which of the following is not a function of the astrocytes?
Oh, is it C?
I think you're right, it's C. So remember, in the central nervous system, oligodendrocytes, microglia, astrocytes, and ependymal cells are the 4 different types of neuroglia. In the peripheral nervous system, there's 2 types. There's Schwann-cytes or neurolemocytes. Excuse me, Schwann cells, or I can't believe I said that. Schwann cells or neurolemocytes. They wrap repeatedly around the nerve fibers of the peripheral nervous system, producing the myelin sheath. It's similar to the myelin sheath observed in the central nervous system, but there are very distinct differences. And satellite cells that surround the soma in the ganglia of the peripheral nervous system. Remember that the ganglia are collections of cell bodies or somas in the peripheral nervous system. So the satellite cells are going to provide insulation around the somas and regulate the chemical environments of the neurons. Gliomas, aka brain tumors in the central nervous system and peripheral nervous system. Most mature neurons, because they don't have centrioles, they don't undergo mitosis. That's the reason you never hear of neuronal neurons forming tumors. Most brain tumors, therefore, are going to arise from the mitotically active glial cells and are called gliomas. They grow rapidly and are highly malignant. most are resistant to chemotherapy because of the blood-brain barrier. This person right here, this is my cousin. And whenever I can, I try to get, when my family will let me, I share photos of things that I've seen. And he had a glioma removed. And I think it's been about 1.5 years, 2 years since then. And he's actually doing really well. But this is why most often chemotherapy doesn't work on gliomas, is the blood-brain barrier. So most often they'll work with it with radiation, and then they'll go after it with surgery because chemotherapy doesn't work. So myelin sheath, spiral layer of insulation around the nerve fibers that's formed by the oligodendrocytes in the central nervous system and the Schwann cells in the peripheral nervous system. You remember we went over this in lab. It's the composition is that of the plasma membrane. You wrap the plasma membrane really tightly around the axon. And the end all result is that the neuron and all of the organelles are squished out to the outer edge. Production of myelin sheath is called myelination. It begins in about the 14th week of embryonic development. And at birth, there is very little myelin in the brain. It proceeds rapidly during infancy and is not completed until late adolescence. This is one of those reasons that we're realizing more and more that not all teenagers can think really abstractly. We make them do it in math classes in high school, not realizing that they're not ready for it sometimes. Because we haven't finished all of the myelination. Dietary fat's important for early nervous system development. This is why they recommend that children under the age of 2 are only given whole milk. And sometimes, depending on what's needed, even past the age of 2, beyond the age of 2. Any questions? You guys, I know normally we would take a break. I'm not going to. I'm just going to keep moving. Be patient with me here. Schwann cells lay up to about 100 compact layers of plasma membrane. The outermost coil of the Schwann cell is the neural lemma. It contains the nucleus and most of the cytoplasm. Surrounding the neural lemma is a basal lamina and a thin coat of fibrous connective tissue called the endoneurium. So neural lemma, basal lamina, and endoneurium. Looking on the way this wraps the way tape would wrap around my pen, like I did the other night. myelin wraps around from the inside out. It's different for the oligodendrocytes. It wraps around from the outside in, pushing new layers of myelin under older ones, so that the myelination actually spirals inward toward the nerve fiber. One oligodendrocyte is going to reach out to the myelinate several nerve fibers. And so because one oligodendrocyte can do multiple nerve fibers, it's anchored in place, unlike the Schwann cells. There's also no neurolemma or endoneurium in the myelin sheath. Because you're pushing new layers underneath old layers. So in peripheral nervous system, myelin sheath of the Schwann cells are going to wrap around from the inside out. In the case of the oligodendrocytes, it's going to push new layers of myelin underneath older layers. And there's going to be no neurolemma or endoneurium. This is going to be important later. Many Schwann cells or oligodendrocytes are needed to cover one nerve fiber, since the fiber is much longer than the reach of a single cell. Therefore, myelin sheaths are segmented, and there's gaps called nodes of Ranvier that are separated by internodal segments. There's an internodal segment separated from a node of Ranvier. Internodal segment, node of Ranvier. The trigger zone is key and very important. We call it the trigger zone because it's going to be what's going to initiate an action potential. If an action potential is going to occur, this is where it's going to occur. This is a short segment between the axon hillock right here and the first segment of the first glial cell of the axon. It has an important role in that it has many voltage gated channels, sodium voltage gated channels. So remember that part. There's lots of voltage gated channels. This is where either we're going to get an action potential that's going to fire down the axon, or we're not going to get one, and it's going to be initiated right here. The signals are going to come in from all of the dendrites, but if we get an action potential, this is where it's going to be initiated. All of those signals are going to sum together, and if we get an action potential, this is where it's going to occur. Multiple sclerosis. Can you turn off your book, Mom? Multiple sclerosis is an autoimmune disorder that can be triggered by a virus in genetically susceptible people. oligodendrocytes and myelin sheaths of the central nervous system deteriorate and are replaced by hardened scar tissue. Remember what does that? The astrocytes, resulting in the disruption of nerve conduction. Variable symptoms can occur depending on what part of the central nervous system is disrupted. Few die within 1 year of diagnosis, but many can live for 20 to 30 years. Each neuron in our bodies has a lifespan of what, on average?
D.
That's right, it's D. Because first off, we don't regenerate them, so they better last for our lifetime, right? Or we're going to be in trouble. So we have myelinated nerve fibers and unmyelinated nerve fibers. Many nerve fibers in the central nervous system and peripheral nervous system are not myelinated. In the peripheral nervous system, unmyelinated nerve fibers are going to be enveloped into Schwann cells. One Schwann cell can harbor up to 1 to 12 fibers within the cell's grooves. Let me put it another way. One Schwann cell can harbor up to 1 to 12 unmyelinated nerve fibers within the cell's grooves. The membrane folds, the neural lemma folds, remember that's the outer layer of the myelin, is going to fold one time around an unmyelinated nerve fiber. Here's the main axon. So the myelin moves around, wraps around it, wraps around it, wraps around it, wraps around it. And in the most outer layers, unmyelinated nerve fibers can be found within the grooves. So within, another way to say this is the Schwann cells that wrap around myelinated axons. In their most outer layers, we can have unmyelinated axons that are wrapped one time by the most outer plasma membrane of the Schwann cell. Some key terms going forward here. And neuronal cell bodies. In the peripheral nervous system, a cluster of neuronal cell bodies is the ganglions. In the central nervous system, a cluster of neural cell bodies is the nucleus. Gotta keep it straight that when we're talking about nuclei in the central nervous system, we're referring to clusters of cell bodies. We're not referring to the part of a cell that contains the DNA. Axons in the bundles of axons in the peripheral nervous system are nerves. Bundles of axons in the central nervous system are tracts. And nerve tissue is grouped into gray matter and white matter. So ganglions, clusters of neural cell bodies in the peripheral nervous system. In the central nervous system, clusters of cell bodies are nuclei. Bundles of axons in the peripheral nervous system are nerves. Bundles of axons in the central nervous system are tracts. White matter, remember, it looks white because of the myelination. So white matter is formed from aggregations of myelinated axons of many neurons. Gray matter is formed from neuronal cell bodies, dendrites, and unmyelinated axons and neuroglia. It lacks myelin, that's why it looks gray. Nerves are found in the what, while tracts are found in the what?
A.
A?
Yeah.
Yep. That's correct. Good job. Conduction speeds in axons or nerve fibers. So remember, axons and nerve fibers, that's a synonymous term. Nerve fiber equals an axon. Depends on two factors. The diameter of the fiber, because signal conduction occurs along the surface of the fiber. So fibers with increased surface area are going to conduct signals more rapidly than smaller fibers. And the presence or absence of myelin. In small unmyelinated fibers, nerve signals can travel at about 0.2 to 0.5 meters per second. In myelinated fibers of the same size, nerve fibers can travel 3 to 15 meters per second. In large myelinated fibers, nerve signals can travel up to 120 meters per second. So diameter of the fiber and whether there's myelin. It's going to determine conduction speeds. Why aren't all our nerve fibers really, really fast? Don't we want everything to be fast? There's a reason fast food, McDonald's makes as much money as they do for yucky food. If you guys like McDonald's, I'm sorry. I'll apologize later. But why do we not want everything to be really fast?
Because some things, if they are really fast, can probably cause damage to other cells or processes.
Right. And it may cause a little bit of chaos. Sometimes we want things, we need things to be a little bit more organized, like Tara said. Slow unmyelinated fibers function in processes such as secreting stomach acid or dilation of the eye's pupil. If you've ever shined a light in someone's eye, it takes a second for their other pupil to react. And it takes a moment for the pupil that you're shining the light in to react. Fast myelinated fibers function in processes such as motor commands of skeletal muscles and sensory signals for vision and balance. Tay-Sachs disease, a disease that's inherited by that's the gene is codes for an enzyme that breaks down a glycolipid. And when you cannot break down that glycolipid, the result is that the glycolipid accumulates in the myelin sheath. And remember how important structure is to function. So as it accumulates in the myelin sheath, it puts pressure on the axon. And ultimately can destroy it. So symptoms are blindness, loss of coordination, dementia, and I think ultimately death. So we said before that nerves do not actively divide. Damaged peripheral nerves may regenerate if some of the soma is intact and some neural lemma remains. If you remember, then the central nervous system, based on the way that the oligodendrocyte myelinates the axon, you don't get a neural lemma. That is why you don't get regeneration of nerves in the central nervous system, but you can get them in the peripheral nervous system. So keep that in mind for right now. How does this occur? So you get a nerve gets severed, normal nerve fiber, like my niece deciding to put her finger through a plain glass window. It gets severed. The end distal to the cut will not survive due to its inability to synthesize proteins. The Schwann cells will degenerate and macrophages will clean up the tissue debris. Muscle cells that no longer have a nerve supply will undergo denervation atrophy, shrinkage. The soma loses the effects of nerve growth factors that are coming from the neuron's target effector cells. As a result, the soma can swell and the endoplasmic reticulum breaks up and the nucleus moves off center within the soma. Many neurons are going to die at this stage. However, if they don't die, the axon stump will sprout growth processes. And near the cut, where the axon was broken, the Schwann cells, the basal lamina, and the neural lemma will form a regeneration tube. The Schwann cells will produce adhesion molecules, CAMs, and nerve growth factors that enable a neuron to regrow to its original destination. These nerve processes can enter this regeneration tube and move back towards their original destination. When one nerve process enters the regeneration tube, it grows rapidly while all the other ones will retract. The regeneration tube will guide that sprout back to its original cells, and the synaptic contact is reestablished. When the synaptic contact is reestablished, the soma will shrink back to its normal size and return to its original appearance, and reinnervated nerve fibers will regrow. Any questions? So Schwann cells and endoneurium are required for nerve fiber regeneration. Because you don't have an endoneurium or a neurolemma in the central nervous system, central nerve fibers will not, central nervous system fibers cannot regenerate. However, because the central nervous system is encased in bone, it tends to suffer less trauma than the peripheral nerves. One thing that I've got a hypothesis. So I have some really good friends, and I think I mentioned this. I think I mentioned this before. I may not have. I have some really good friends who had a baby who sustained 2 hemorrhagic strokes 12 hours after he was born from an accident that occurred in the nursery. And what they told his parents, because he lost major parts of the 4 lobes of the brain, they told him that his chances of survival were 10%. And if he survived, he would be a vegetable. And he's not. He walks, he talks, he eats, he does struggle with a lot of different things, but he's got personality, and he's actually a very smart mathematician. And if you don't get regeneration of the central nervous system or the neurons, how did he survive such a massive hit? And the only way that I know how to probably best describe this is that when you're a baby and you're 12 hours old, your brain is still growing massively. It's also not myelinated. A lot of it is not myelinated. And from what his mother says, and she's a pharmacist, so she's a fairly smart individual. From what she says, what's happened is that the brain has continued to grow and isolate the dead, damaged areas to certain spots and continue to grow and develop. And that's looking at MRIs. And that's the only way that I can really describe that right now, is how he survived as well as he has.
Professor Gessel, do you know of like a certain time span it takes for, for a regeneration of nerves to happen? I mean, is there a time span or does it vary?
It can vary a lot. And sometimes they never regenerate. I think it depends on a lot of factors. It can be several years. It can be a few months to several years. If you've ever had what I've had, where they go in to put anesthesia in your mouth and they hit a nerve. Have you ever had that happen? It's not fun and it really hurts.
Well, I severed a tendon in my hand with a steak knife.
Ouch.
And oh yeah, oh yes, my stupidity totally on me. But it's never like, it's all repaired and everything's workable, but it's just not, the sensation's just not there, like, or it's weird feeling. It's just when I bend my thumb, it's a really weird. So apparently it's never going to be.
How long ago was it?
Oh my gosh. About 21 years ago.
It's not coming back.
Yeah, no.
No, my niece, and I'll show you the pictures when we talk about it, when we talk about muscles and tendons, the last lab we have. My niece severed a tendon and a nerve in her finger when she put her finger through a glass pane window. And she severed like 90% of the nerve. And they've told her that she may or may never regain all the feeling back. And she's 14. So you're probably never getting it back at this point.
Figures.
I know that since my rack that I had, I have really weird feeling in my mouth. I don't feel a lot of things. And I have feeling where I shouldn't have had feeling, because when they went in and did the first surgery when I was 12, they went in and cut a lot of nerves to do what they did. And they said that I may or may never get the feeling back. Well, I got it back. But then when I was 27, 28 and decided to run my car into a median, I don't have the feeling back as much as I did.
The rule is usually 6 to 12 months.
6 to 12 months. My mother says the rule is 6 to 12 months, so you're out of luck. Not coming.
Way past that.
I did the same, not to get on a tangent, but real quick, I did a same thing about, I'd probably say like 15 plus years ago to my ring finger with a box cutter. And I still to this day cannot reach. Like if I go to reach with this hand real fast, it's like electrical, and like I can't, like still to rub on that finger, it feels strange.
I know that microbleeding will do it to you too. And I think it's around the myelin, because I have nerve damage up the side of my face from my wreck. And it's never really gone away completely. And what happens is if you microbleeding, because that myelin is key to your function of that nerve. And what I think I did, I didn't cut any of the nerves up here, as far as I know. But I smashed it really well. And the result is that I get sensations up the side of my face. So I think, but I think you're out of luck with 21 years. And Marissa, you're probably out of luck too. How long ago was that?
I'd probably say like 15 or maybe even more, 16, 17 years. That's a long time.
Yep, you're out of luck.
Yeah.
Did you see the there's a scientific study that was, I think it's a scientific study, or it was like a research that was published with paraplegics, and apparently they use an implant that stimulates the nerves, and apparently to like help with pain and everything, like to help with like the ghost pain. Apparently that same stimulator, if placed at a certain like angle, it can help restore the ability to walk.
I believe it. But I think that's very, yeah, I believe it.
I'll post a link to the article that I found.
Okay. So second half of chapter 12. Electrophysiology. How does a neuron generate an electrical signal? How does it transmit a meaningful message to the next cell? Electrophysiology, so an electrical potential. You guys remember talking about membrane potentials. For you, it wasn't very long ago because we talked about it in lab 2 weeks ago. Difference in the concentration of charged particles between one point and another. This is a potential energy source because it can produce a current that we can then we can use to do other things. And in this case, we use it to transmit a signal. A current is a flow of charged particles from one point to another. Currents are created by the flow of sodium and potassium through gated channels, which are going to open and close in response to different stimuli. The currents can be turned off and on by opening or closing those channels. As long as there's a separation in charge or a voltage, we say that a battery or a membrane is polarized. In a resting neuron, the greater number of positive ions are located outside of the cell, causing the cell to be electrically charged or polarized because the inside of the cell is more negative. This charge difference across the plasma membrane is the resting membrane potential. So same as your typical battery, your car battery, where the red, as I know how to jump my battery, I don't know the terminology. What do we call that? The red. Somebody help me out here. What's the red? Electrode? Is that what it's called on the battery, car battery? Terminal. Yeah. Okay, terminal. Why didn't I just read the slide? Terminal. Red terminal is the positive. The negative terminal is black. So the inside of the battery is more negative. The outside of the battery is more positive with regards to the membrane. The outside of the cell is more positive. The inside is more negative. It's polarized. There's a separation in charge. We can allow the charge to move and couple it to something else, like passing a current down a cell, an axon. so potentials, this potential energy source results from the diffusion of ions down their gradients through the membrane. The selective permeability of the membrane to some ions. The electrical attraction of cations and anions to each other. So here we have, this membrane is not that thick. Positive and negative ions. The separation of the two is an energy force all in itself, because positive likes to attract to negative. And right across the membrane from one another, they're going to be attracted to one another. The resting membrane potential in neurons is typically about -70 millivolts. So the inside is -70 millivolts more negative than the outside. The outside of the cell contains more sodium. The inside has more potassium. And the other major reason why the inside of the cell is more negative is because there's large anion proteins that are trapped inside the cell. Potassium ions have the greatest influence on the resting membrane potential because the membrane is most permeable to potassium. The potassium diffuses freely through ion channels, leaving more larger negatively charged anions behind in the cytoplasm. However, some potassium is attracted back by the anions in the cytosol. Remember, the cytosol is the cytoplasm within the cell. So negatively charged proteins are always remaining in the cytosol, and they can attract some of the potassium back. The sodium is 12 times more concentrated in the extracellular fluid than it is in the intracellular fluid. However, sodium very slowly leaks back into the cell. And then we have a sodium-potassium pump that continues to pump 3 times more sodium out of the cell and 2 more potassium out into the cell through the hydrolysis of ATP. So there's 4 major factors that are involved in maintaining this. Potassium ions have the greatest influence. Negatively charged proteins that are trapped within the inside of the cell. The sodium is 12 times more concentrated outside of the cell. And the sodium-potassium pump is maintaining these concentration gradients of sodium and potassium. Remember, remember how I'm trying to enforce with you to think of this as a battery, a separation and charge. And the great thing about this battery is that you can it can regenerate its separation and charge. You can recharge this battery. The way you recharge it is that sodium-potassium pump.
I don't like these, Professor Gessel.
You do, Justin,
don't-
you have to keep saying how much you love them.
Well, that's Alan just got home from the store and as soon as I said it, he's like, you need to like them. They're important. I'm like, I don't want to like them.
They are. Alan is right.
I still can't wrap my head around them. I have to keep revisiting this because every time I think I kind of have it, I feel like I don't have it.
You know what? We will, let me see if I can't help you figure it out. Okay, so this uneven distribution of sodium and potassium only pertains to a very thin film. So remember that I made the comment before, this is a very thin plasma membrane. Positively charged ions out here, negatively charged ions in here are attracted to one another across. That's also a major driving force here. So there's an uneven distribution, and it pertains only to the most inner and outer parts. The rest of the lumen inside the axon is not affected. What if a plasma membrane had a neuron that had more sodium leak channels than potassium leak channels? How would this affect the resting membrane potential?
Would it be slower?
Let me ask this a different way. Would it be more positive? Would the resting membrane potential become more positive or more negative?
Would it be more positive? Because there's not as large of a difference between the outer and inner.
Yes. And in a minute, I'm going to ask you, why is that important to generating an action potential? But yes, so that's right, because if we allow, remember, there higher sodium out here, like Max was saying, higher sodium out here, higher potassium inside here. You start allowing more sodium in because it's going to flow down its concentration gradient. The result is you get a more increased positively charged ions inside. And the result is that the resting membrane potential is no longer as negative because the inside is more negative than the outside. The result is that the inside of the cell becomes much more positive, making the resting membrane potential a lot less negative. They're AKA more positive, like Max said. And what I would maybe even think about it, if this is hard for you to think about, which I know Justin, I understand completely, is think of it as we're pumping every time that sodium potassium pump is pumping 3 sodium out, 2 potassium in. Rather than bring the protein anions into this, just say, look, it's got to be less negative. It's got to be less negative inside because we're pumping less potassium in than we are outside. Just think, don't worry about the rest of it. Think of it as let's just worry about the sodium and potassium right now. We're not worried about anything else. Because really the proteins, that's something that doesn't change. All we're looking at is movement of sodium and potassium. three kinds of gated channels. We have ones that open in response to a chemical ligand binding. We have ones that get bumped and they open or close, or the pressure changes and they open and close. And we have ones that are going to change as a result of voltage change. If the resting membrane potential becomes more negative or more positive, things will open and close. So ligand gated channels open and close in response to specific chemicals. These chemical ligands include neurotransmitters, hormones, and ions. Many are concentrated at the synapse. There's numerous ones in the dendrites and cell bodies of interneurons and motor neurons. Mechanically gated channels are going to open and close in response to mechanical pressure or vibration. They're found in hearing receptors, stretch receptors, and touch receptors, and applying pressure to a receptor. So they open and close, and hearing receptors, stretch receptors, touch, pressure, bumping. Voltage gated channels are going to open in response to a direct change in the voltage. These channels participate in the generation and conduction of action potentials and are mainly located along the neuronal axon. We have two major types of potentials. We have graded potentials and action potentials. Graded potentials only move over a very short distance. Action potentials communicate over long distances in the body. Which ones travel the greatest distance? Action potentials. As you touch a pen, a graded potential develops in the sensory receptors of the skin at your fingertips. Once the interneurons in the cerebral cortex are activated, perception of your feeling that pen results in you feeling the surface of the pen. So graded or local potentials are changes in the resting membrane potential of a neuron that occur at and nearby part of the cell that's stimulated. They are produced first. Graded potentials vary in magnitude according to the strength of the stimulus. They're decremental, meaning that they get weaker as they spread away from the point of where they occurred, where they were initiated, and they can undergo summation. You can add one graded potential to the next one, or one graded potential can eliminate the effects of the another one. they're reversible. Once the stimulus ceases, whatever the stimulus was that started them ceases, the sodium potassium pump will quickly return the voltage back to the resting membrane potential. They also can be excitatory or inhibitory. They can make the resting membrane potential more negative or make it more positive. If they make it more negative, they hyperpolarize. So rather than just having a small separation in charge, you have a massive separation in charge. That's hyperpolarization. So when we talk about a resting membrane potential, I'm going to skip you up a little bit. Talk about a resting membrane potential being minus 70. Well, what if it's minus 100 instead? So the charge difference is greater inside and outside of the cell. That's hyperpolarization. A depolarization is when we're going to move it from minus 70 to minus 50 and make it less negative inside the cell. Justin, you're nodding, so I'm hoping this is working for you.
I just hope it sticks.
It will. It will. Okay. So graded potentials mean that the potential can vary drastically based on the stimulus strength. The greater the stimulus strength, the larger the amplitude of the graded potential. A more intense and prolonged stimulus can result in more gated ion channels being open for a longer time. And the result is that more sodium enters the cell. Than it would with a weaker stimulus. This is the same for both hyperpolarizing graded potentials that make the resting membrane potential more negative and depolarizing membrane potentials that are going to make the more positive inside the cell. These can summate. So they're one amplitude, one potential can be added to another one, or they can cancel one another out. The net result is that you get a larger or smaller graded potential. Because they die out with decremental conduction, meaning they're going to die out as they move further away from where they were started. Graded potentials are only useful for short distance. Depolarizing graded potentials. Here we are, minus 70 millivolts. This is our resting membrane potential. If we make it more positive, bear with me here. So here's my membrane right here. Inside is minus 70 in comparison to the outside, which is 0. Okay. That's what minus 70 millivolts says, is that In comparison, when the outside is 0, the inside is a -70. If we get a depolarizing resting membrane potential, what that means is that this is no longer -70, but it's actually -60. So it's only 60 millivolts less than it is outside. This is depolarization. So the resting membrane potential is being made more positive, or it's moving closer to 0. It actually, ultimately, it's going to reverse. The inside is outside. To me, the inside's going to be more positive than the outside. But right now, anytime we hear depolarization, what it means is that the resting membrane potential is being made more positive. If it's repolarizing, the resting membrane potential is being made more negative. So it's going back. If it's repolarizing, it was at like -50 or +30 inside the cell, and now it's going back to -70. So we're always looking at what's the voltage inside the cell. Hyperpolarizing meaning the resting membrane potential is being made more negative than -70 in comparison to the outside. More negative than millivolt 70. So maybe it's now -100 instead of -70. Making it even more, polar always means a separation in charge. Depolarization, meaning that we're making the inside closer to the outside in charge, that outside's charge. Repolarizing, meaning we're separating them again. Hyperpolarizing, meaning we're making the inside even more negative than it normally would be. So depolarizing grading potential, the membrane, the stimulus. So look, this range right here is just showing what the inside voltage is in comparison to the outside. Outside is 0. We're just looking at what the inside is, how the inside charge is changing. So stimulus causes depolarization is going to cause a reduction in the difference in charge across the membrane. So the inside of the cell becomes less negatively charged or more positive. The hyperpolarizing graded potential is that the stimulus causes the cell to become more negatively charged than the outside it originally was. So rather than being at -70, it's now at -75. Different neurotransmitters can cause depolarization or hyperpolarization. Acetylcholine, when it's in a synaptic cleft, usually causes depolarization with more sodium entering the cell, and therefore the cell becomes the inside of the cell becomes less negative, aka more positive. As the cell membrane becomes more positive, it's more likely to reach a threshold value that was required to reach an action potential. So at a certain amount here of negativity, once we reach a certain amount of negativity depolarizing wise, we're going to reach a threshold where we can fire an action potential. If we receive a signal such as glycine that usually causes hyperpolarization, the membrane potential becomes even more negative. Therefore, it's less likely to reach that threshold. And therefore, we're less likely to fire an action potential. Graded potentials occur as a result of opening mechanical or ligand-gated channels. So whether the membrane potential becomes more positive, meaning it depolarizes, or more negative, meaning it hyperpolarizes, depends on the type of channel that opens. Which type of potential does not decay with distance?
Action potentials.
It's an action potential, right? That last one, generator potential, that's just a made-up term. I don't know what that is. If it means something, I don't know what it is. So action potentials are this dramatic change produced by voltage-gated ion channels in the plasma membrane. They only occur where there's enough of a density of voltage-gated channels. Most of the cell's soma contains only 75 channels per micrometer squared. The trigger zone, remember that's this bottom part right next to the axon, has 350 to 500 channels per micrometer squared. So if a strong enough excitatory local potential arrives at the trigger zone, it can open these channels and generate a signal. And the signal is this rapid up and down shift in the membrane's potential. So looking at this graph really quickly here. So we were at the resting membrane potential. We got a small depolarizing graded potential. So now we're at minus 60 instead of minus 70. And then right next to where our graded potential occurred before our next potential dies out, we get another one. And it puts us at like negative 58. Threshold is negative 55. And so these two sum, but then we get a depolarizing, excuse me, a hyperpolarizing one where it cancels out the last one that was done. And then we get another one where it cancels it out slightly. And then we get another one that increases the resting, makes us the inside of the cell again more positive. But it gets canceled out by the next hyperpolarizing signal. And then we get a massive depolarizing that allows us to reach this threshold, and then an action potential is fired. Once we reach minus 55, that's threshold. So an action potential is this rapid up-down shift in the membrane's potential. So an action potential is going to occur when a steadily rising local potential that continues to summate arrives as a current at the axon hillock, and we reach threshold. It depolarizes the membrane to the point of where we reach threshold. It will open a bunch of sodium gated channels. What happens if we open a bunch of sodium gated channels? Max, you can't answer. What happens if we open a bunch of sodium gated channels?
More sodium gets into the cell, making the charge more positive.
Right. So we're going to, the resting, we're going to get a rapid depolarization where the inside of the cell is going to become very positive. It's going to bypass the outside charge and become even a positive 35. So this neuron is going to produce an action potential with a bunch of sodium gated channels opening quickly, while simultaneously slower potassium channels are going to slowly start to open. They're going to be a lot slower in their opening. A few sodium channels open, but then as the cell continues to depolarize, more sodium channels open. So this is a positive feedback loop where the change in the initial membrane voltage opens even more channels and more channels and more channels, resulting in this rapid depolarization. Think of depolarization as things becoming much more positive. As the membrane potential rises past 0 millivolts and peaks at positive 35 millivolts. So inside we're now at 35 millivolts. The sodium channels get inactivated at 35 millivolts and they start to close. But at this point, those sodium channels, they close at this positive 35. And the potassium channels are now completely open. They started opening here, but they were a lot slower. So they fully open and they repolarize the membrane, making it more negative again and bringing it back down. And so this action potential has this rapid up and down motion when the voltage, initial voltage, reaches the threshold. Potassium channels, they don't close as quickly as the sodium channels do. So the result is that the potassium channels will stay open longer. And so more potassium leaves the cell than sodium enters, resulting in a slight hyperpolarization of the membrane, where it's now, rather than being -70, it's -75 or -71 or 72. So during an action potential, the sodium and potassium are going to switch places. Sodium is going to rush in, potassium channel, while the potassium channels slowly open. And then at positive 35, the sodium channels are going to close and potassium is going to rush out. And the membrane voltage will gradually return to the resting membrane potential. I'm thinking about continuing with lecture on Wednesday. I'll send out an email if I decide to do that, because I think one of the labs, I'm trying to remember looking at the syllabus, and I'm sorry, I'm only thinking about this after we're done. But I don't want to just keep jumping ahead and lap. I'll be really quick about this because I know we're over time at this point. Do you have also, while I'm looking for this, are there any questions about these action right now, about these action potentials? Justin, is it clear to you now?
I will have many questions later, I'm sure.
Okay. And that's all right. You know what? I'm thinking about skipping this autonomic nervous system and pushing this back 1 week. I want to do the special senses. I normally wouldn't do a special senses lab like online, but I did promise Justin's little girl that we dissect an eyeball. And so we have to do that one. You don't make promises you're not going to keep. Would it be all right if we continued with lecture and I gave you 10 points for a lab later?
That'll work.
Okay.
I like those 10 points.
Well, yeah, it's a free 10 points, so you don't have to work for it. Let's do that. And let's see if we can't get a little bit more caught up than where we are right now. And I'll figure out how to make Wiley do what I want it to do and give you those 10 points. All right, I will.
So does that, sorry, real quick, does that
Go
affect
ahead.
anything that's due this week at all?
I still want you to, if you can, if there's a problem and you can't get something submitted, just let me know.
Okay.
But right now, I'd still like to have everything in because it just means that it gets pushed out another week.
Okay. Awesome. Thank you.
You're welcome. Have a wonderful 2 days.
You too.
Mary, I wanted to let you know, I'm going to be in a Zoom meeting on Wednesday from 5 to 6 with career services. So I might be a couple minutes just logging into your class, but
You know what, Sherry, I don't even notice. Actually, I do notice because you're one of the first people who actually joins every time. So I do notice, but normally, no, I don't notice.
okay, well, I just wanted to let you know, I'm going to be here. It's just,
I would, because I can see your face every time, I would know if you weren't here all night. But otherwise, I don't really notice.
all right. Have a good evening.
You too.
Thank you, Professor Gessel. We'll see you on Wednesday.
See you on Wednesday.
Have a good night.
You too.
So I finished chapter 7 and chapter 12 for the smart book and the quizzes.
Okay.
Am I able to work ahead?
Yes, I think you can. Can you not?
I've actually, I was planning on like continuing working ahead, but I've fallen behind, so I haven't been able to do it recently.
If you can't, let me know and I'll open some things up for you. Okay.
Yeah, it says it's not gonna let me. I can't access the smart book.
I'm sorry. It says that it's not gonna let you.
Yeah, I can't click the links for the smart book for chapter 13.
Bear with me here.
Is that what we're doing next? Is chapter 13?
Yes.
Okay.
Bear with me just for a second here.
Okay.
Let's
see, what else do I have? Oh. I'll just quickly.
Let's see here.
If it's possible, I mean, it's
no, it's not hard.
necessary.
It's not hard for me to do it. It's not hard for me to do it. So give me 2 seconds. But if I do it right now, I won't forget to do it. That's the important part.
So I posted a link, like a news article.
Okay.
To the study that I mentioned earlier about how like they're able to use the stimulants to jolt the spinal cord.
Okay.
Like, are you gonna talk more about like spinal cord injuries and like spinal
you know
cord
what? I
disorders in
don't.
the next...
I honestly, I don't know a lot about them, and we don't really have time.
Okay.
We're running out of time a little bit. And so shoot, just a sec. Continue. So I don't plan, I mean, we do a little bit, but not very much.
Okay. I mean, I was just curious to see like what exactly, like for the next chapter, like what we're going under, like gonna go over.
Yeah, I can understand that. Okay.
I just found it interesting because it's like normally like when you are paraplegic,
yeah,
usually it's like it never comes back. But
right.
It looks like Jennifer may have questions, but I'm gonna leave. I have to get up at 4 in the morning.
Lauren, it should open up in about 10 minutes.
Cool, thank you.
You're welcome.
Bye.
Bye.
I
Hi,
just-
Jennifer. How are you?
Good. How are you?
Good.
I just wanted to, it's kind of like she was saying to be able to work ahead, but I don't want to work that far ahead. I have a surgery coming up on my eyes.
Oh,
on
wow.
April 7th. And so for a couple days, I'm not supposed to be like on screens and things.
Okay. I understand.
So I was just going to work ahead and then be on like my phone and then look on paper. Because
Okay.
I usually I print everything out anyway ahead of time.
Okay.
So, I mean, if there's any issues, I'll just message you, but I think I should be okay if I work ahead. I just wanted to ask if that was
Alright.
okay.
Yeah, that's fine. Let me know if there's something you need me to open.
Okay.
Okay.
I think we'll be okay because usually you have at least what we're working on open ahead of time. And I don't want to plan on working like chapters and chapters because I'll start to confuse myself when trying to
I can understand that.
balance everything of what we're going over and not mix them up. But and then already with lab, it's like you said, they're not on track. Like they're not
Right.
kind of the same thing. So
Right.
but I think that should solve the problem. I was gonna say I didn't know what to do because I didn't realize it was like 4 or 5 days that I wasn't allowed to, and I thought it was just 2 days, and I like worried, and I was like, oh no, what am I gonna do if I can't be on the screen? But I was like, well, I don't have to be on video. I can be on my phone just listening and
Right.
follow through with paper. So I'll
Right.
just work ahead. But if I do have anything that's closed, I'll just message you or ask you next lecture. I'll go ahead the week before and
Okay.
ask. So I just wanted to make sure that was okay.
That's fine. Yeah, thank
Alright.
you for letting me know. That's fine.
Yeah, absolutely. Thank you.
Have a good night, okay?